Missed your period for months? It might not be stress, it could be amenorrhea. In this video, we break down the causes, symptoms, and treatment of this often misunderstood condition. Amenorrhea means the absence of menstruation. It's classified into two types, primary and secondary. Primary amenorrhea, no period by age 15 inches. Secondary amenorrhea, missed 3+ periods in a row.
Causes of amenorrhea. Many factors can lead to amenorrhea, from hormonal imbalances to lifestyle and medical conditions. Hypothalamic dysfunction, polycystic ovary syndrome, PCOS, genetic disorders, e.g. Turner syndrome, extreme exercise, eating disorders. Medications or contraceptives. Signs and symptoms. Amenorrhea doesn't come alone. Look out for signs based on the underlying condition. Hormonal, acne, hirsutism, infertility. Metabolic, weight loss, gain, fatigue. Structural, pain, anatomical abnormalities. Psychological, anxiety, stress.
Diagnosis. Diagnosis includes history, physical exam, and tests. Investigations includes blood tests, FSH, LH, prolactin, estrogen, TSH, testosterone. Imaging, pelvic ultrasound, MRI brain, progesterone challenge test, genetic testing.
Treatment strategies. Treatment is based on the cause. Not all amenorrhea is treated the same. Treatments includes hormonal therapy, estrogen, progestin, PCOS, metformin, lifestyle. Tumors, surgery, radiation, counseling, eating disorders, corrective surgery, Asherman, calcium, vitamin D for bone loss. Complications if left untreated. Untreated amenorrhea isn't harmless. Complications include infertility, osteoporosis, heart disease due to low estrogen, endometrial hyperplasia, PCOS. Prevention and self-care tips. Lifestyle advice are balanced nutrition, avoid overtraining, stress management, monitoring weight changes, track periods monthly.
Let's have some case studies. A 15-year-old girl is brought to the clinic because she has not started menstruating. She has short stature, a broad chest, and a webbed neck. Physical exam reveals no secondary sexual characteristics. Her karyotype is 45XO. Which of the following is the most likely diagnosis? Options are A. Kallmann syndrome, B. Turner syndrome, C. Androgen insensitivity syndrome, D. Hypothalamic amenorrhea, E. Mullerian agenesis. Explanation. Turner syndrome is a common cause of primary amenorrhea, with characteristic features: short stature, webbed neck, and streak ovaries leading to low estrogen and elevated FSH/LH.
An 18-year-old female athlete reports amenorrhea for the past 6 months. She trains intensively and follows a low-calorie diet. Her BMI is 16. Labs show low estrogen, LH, and FSH. Which of the following is the most likely cause of her amenorrhea? A. Hypothalamic suppression due to energy deficit. B. Premature ovarian failure. C. Prolactinoma D. Asherman syndrome. E. Polycystic ovary syndrome, PCOS. Explanation. Low energy availability suppresses GnRH right pointing arrow down pointing arrow LH, FSH right pointing arrow down pointing arrow estrogen right pointing arrow functional hypothalamic amenorrhea.
A 28-year-old woman presents with secondary amenorrhea for 4 months and spontaneous galactorrhea. Pregnancy test is negative. Prolactin is elevated. What is the most appropriate next step in management? A. Start oral contraceptives. B. Measure TSHC. Obtain pelvic ultrasound. D. Order MRI of the brain. E. Prescribe bromocriptine empirically. Explanation. Elevated prolactin with amenorrhea and galactorrhea raises suspicion for a pituitary prolactinoma. Imaging is necessary to rule out a mass.
A 17-year-old girl presents with primary amenorrhea. She has well-developed breasts and external female genitalia. Pelvic ultrasound reveals the absence of a uterus. What is the most likely diagnosis? A. Kallmann syndrome. B. Turner syndrome. C. Androgen insensitivity syndrome. D. Mullerian agenesis. E. Constitutional delay of puberty. Explanation. In Mullerian agenesis, MRKH syndrome, patients have normal ovarian function, thus normal secondary sex traits, but no uterus due to failure of Mullerian duct development.
A 25-year-old obese woman presents with irregular periods and amenorrhea for 5 months. She reports excessive facial hair. Pelvic ultrasound shows enlarged ovaries with multiple small follicles. Us. What is the most likely diagnosis? A. Prolactinoma. B. PCOSC. Thyroid dysfunction. D. Asherman syndrome. E. Premature ovarian failure. Explanation. Classic presentation of PCOS includes obesity, amenorrhea, oligomenorrhea, and hyperandrogenism with characteristic ultrasound findings.